200,000 health workers are set to be vaccinated when the Janssen & Janssen vaccine arrives in Port Elizabeth at Livingston Hospital this afternoon. Livingston Hospital and Nelson Mandela Hospital in Mthatha have been identified as the two vaccine sites. But on the ground, we want to hear how are health workers feeling about the vaccine and its arrival in Port Elizabeth this afternoon. Joining me this afternoon is Sweetness Sitoke from Nahau. Tell us more exactly on the ground, what are health workers? Are they excited? Are they keen to take this vaccine? Sweetness, the vaccine arrives this afternoon. On the ground, through interaction with healthcare workers who are first to be prioritized in the first phase, how are they feeling about this vaccine?
There are mixed emotions, to be honest. There are mixed emotions. Others are excited, especially those who are chronic, those who have tested before, those who were critical in terms of COVID. But others are skeptical because of the news that have been there, especially considering the fact that what is supposed to be taking place this week was supposed to take place last week, and then there were a lot of issues that were raised. Then we needed to put a handbrake on it. Otherwise, as a union, we are saying that we are welcoming any intervention because remember, Nahau is one of the unions that lost a lot of members through COVID. So there are mixed emotions on the ground, and the fact that the department has not been committed in taking us into confidence at the level of the district as to how is going to be the rollout and all those things that we wanted clarity on. It's not assisting in us putting confidence in our members. That is the challenge that we have as Nahau in this district at this point.
In terms of the rollout, and also what we have heard from people on the ground is that there was not perhaps enough teaching about how the vaccine is going to work, how it's going to be implemented and rolled out, like you said earlier on. Is that also the concern of health workers on the ground?
It is, and as the leadership in this region, we've raised that thing. Fortunately, last week, Monday, there was a visit from the Portfolio Committee of Eastern Cape, and the district was expected to present the state of readiness. We were invited also by the Provincial Portfolio Committee of Health. On their presentation, there were scrappy presentations that did not make sense. The Portfolio Committee was not happy, and also they were not happy more because Labour was not included. And we've raised this thing with the district manager, DeForce, and she was given a directive to make sure that they go back and make sure that in the task team, all the key stakeholders must be involved. You must involve traditional healers, the traditional healers, you must involve the church leaders and everyone. And they have not done that. And other departments, social development, Department of Education, because remember, this issue of COVID, it talks to our society. They have not done that. They have kept the information to themselves. So the meeting could not proceed on the basis that this district was not ready. Up until today, they have not done that. And as Nahau, we went to her office and told her that we do not want her in this district. If I can tell you now, if you can go to her and ask her what strategy did she use to drop the numbers in the metro, she won't be able to respond because it is our members who are in strategic position who've worked hard to make sure that we fight this COVID. All they do is to take the trophy when we are announced that we've done great work. So we are not happy. We are announcing it publicly. We will be also tomorrow meeting with the leadership of the province where the members of the portfolio will be part of that meeting as well as the provincial office of the MEC, whereby we are saying that we want someone who's competent. Dr. Matiwane and DeForce are not assisting us. As we speak, there is a motion that is going around that the hospital, Dr. Ngobeni, must close because patients are low. We are saying that you can't close a field hospital when your own minister, Dr. Mkhize, is foreseeing a third wave. They are moving patients to Radisson Hotel, yet they claim the department does not have money. So our members are not happy. As a union, we are not happy. I know that it's not only Nahau alone. In that session, when we took a decision that she must leave the district because already we know that she was recycled here. She did corruption and a lot of activities at Sarapanman. So we are saying that we want someone who's competent, who's going to maintain the position we are in now as a metro. Otherwise, in terms of vaccine, as a union, we are welcoming it, but we are not happy because we need clarities, we need more information. What is the strategy? How is it going to roll out? So that we are able to put comfort and confidence in our members that their life, their health will not be jeopardized.
Well, that was Sweetness Stalker, Regional Secretary of Nahawu here in Nelson Mandela Bay Metro, and she was saying, as Nahawu, they welcome the vaccine because a lot of members from Nahawu have passed away due to COVID-19 pandemic, and anything that can save more lives is acceptable and also appreciated. But she's saying the greatest concern for health workers and general workers on the ground is that there hasn't been a clear plan and involvement of such stakeholders such as Nahawu in terms of how is the vaccine rollout going to happen, when is it going to start, who's going to prioritize when and how. So in terms of the logistics of the rollout, her concern is that not enough information has been communicated to stakeholders that are such important factors in this vaccine, such as Nahawu. But for now, let's go back to you in studio.